Robert had always been the energetic one in his friend group. At 63, he still played tennis twice a week, gardened every weekend, and walked his golden retriever every morning without fail. But over several months, something shifted. He found himself needing to sit down after climbing the stairs to his bedroom, something he'd done thousands of times without a second thought. He brushed it off as getting older, maybe being a bit out of shape. Then came the morning he couldn't catch his breath after tying his shoes. That's when his wife insisted he see their doctor. What they discovered potentially saved his life. Robert was experiencing early warning signs of heart failure, signs that millions of adults over 60 encounter but often dismiss as normal aging. The truth is, your heart doesn't have to fail you as you get older, but it will send you messages when something's wrong. Learning to recognize these signals can mean the difference between early intervention and a life-threatening crisis. The first and perhaps most commonly overlooked sign is unusual fatigue that seems disproportionate to your activity level. Now, everyone feels tired sometimes, and yes, energy levels do change as we age, but we're talking about something different here. This is the kind of exhaustion where simple daily tasks that never bothered you before suddenly feel overwhelming. You might feel drained after taking a shower, need to rest after making the bed, or find yourself unable to complete a grocery shopping trip without feeling completely wiped out. This happens because when your heart isn't pumping efficiently, your muscles and tissues aren't getting enough oxygen-rich blood. Your body is literally being underfueled, like trying to run a car on a half-empty tank all the time. What makes this particularly tricky is that the fatigue often develops gradually over weeks or months, so people adapt to it without realizing how much their capacity has diminished. They start doing less, moving slower, and convincing themselves it's just part of getting older. But here's what cardiologists want you to know. Significant changes in your energy levels and exercise tolerance are never normal, regardless of your age, and they always deserve medical evaluation. The second warning sign is shortness of breath during activities that never caused breathing problems before. This isn't about being winded after running up 3 flights of stairs. We're talking about breathlessness that occurs during routine, normal activities. Maybe you notice you're breathing heavily after walking from your car to the store entrance, or you find yourself pausing for breath while having a conversation, or you wake up at night feeling like you can't get enough air. Some people describe needing to prop themselves up with extra pillows to breathe comfortably while sleeping. This symptom occurs because fluid can back up in your lungs when your heart isn't pumping effectively, a condition called pulmonary congestion. The medical term for nighttime breathlessness is paroxysmal nocturnal dyspnea, and it's one of the classic signs that cardiologists specifically ask about during examinations. What happens is that when you lie flat, fluid that's been settling in your legs during the day redistributes to your upper body and lungs, making breathing difficult. Many people unconsciously adapt by sleeping in recliners or stacking pillows, without realizing this is their body's way of compensating for a heart problem. If you're experiencing unexplained shortness of breath, especially if it's progressively worsening or occurring with less and less exertion, this needs immediate medical attention. The third sign that should raise red flags is swelling in your legs, ankles, or feet, particularly if it's new, worsening, or more pronounced at the end of the day. In medical terms, this is called peripheral edema, and it happens when your heart can't pump blood effectively enough to keep fluid from accumulating in your lower extremities. You might notice that your shoes feel tight by evening when they fit fine in the morning, or that pressing on your shin leaves an indentation that takes a while to bounce back, or that your socks leave deep marks on your legs. Some people notice their rings getting tighter, or that they're gaining weight despite not eating differently. That weight gain is actually fluid retention, and it's a significant concern. Just 2 or 3 pounds of fluid gain can indicate your heart is struggling. Now, swelling can certainly be caused by other things like medication side effects, venous insufficiency, or kidney problems, but when it appears in adults over 60, especially combined with any of the other symptoms we're discussing, Heart function needs to be evaluated. The reason this matters so much is that fluid retention indicates your heart isn't maintaining proper circulation, and this can escalate quickly if not addressed. The fourth warning sign is experiencing an irregular heartbeat or palpitations that feel different from your normal heart rhythm. This might feel like your heart is racing, fluttering, skipping beats, or beating too hard in your chest. Some people describe it as feeling like a fish flopping around in their chest. You might become suddenly aware of your heartbeat when you're sitting still and relaxed, which isn't normal. The most common culprit behind this symptom in older adults is atrial fibrillation, often called AFib, which affects millions of people over 60. In AFib, the upper chambers of your heart quiver instead of beating effectively, which significantly increases stroke risk and indicates underlying heart problems. Here's what's particularly dangerous about this. Many people experience AFib episodes that come and go, called paroxysmal AFib, and they might dismiss these episodes as stress or too much caffeine. But even occasional AFib needs treatment because every episode increases stroke risk. Some people have no symptoms at all with AFib, which is why heart rhythm checks become increasingly important after 60. But if you do feel palpitations, especially if they're accompanied by chest discomfort, severe shortness of breath, or dizziness, you need emergency medical care immediately. Even without those severe symptoms, any new or changing heart rhythm irregularities warrant a call to your doctor, and likely an electrocardiogram to see exactly what your heart is doing. The fifth early warning sign is unexplained dizziness or lightheadedness, particularly when standing up or during physical activity. This can range from mild wooziness to feeling like you might actually pass out. Some people describe it as the room spinning or feeling unsteady on their feet. This happens because your brain isn't getting adequate blood flow, which can occur when your heart isn't pumping strongly enough or when your heart rhythm is irregular. Blood pressure that drops when you stand up, called orthostatic hypotension, becomes more common after 60 and can be related to heart problems, dehydration, or medications. But dizziness can also signal dangerous heart rhythms or inadequate cardiac output. What makes this symptom particularly concerning is the fall risk it creates. Falls are a leading cause of serious injury and death in older adults, and if the underlying cause is a heart problem, both issues need addressing. If you experience dizziness along with chest pain, severe shortness of breath, or if you actually lose consciousness, this is a medical emergency requiring immediate care. Even without those severe symptoms, frequent dizziness or balance problems need thorough evaluation. Now here's what ties all these symptoms together and why they matter so much. Heart disease remains the leading cause of death for both men and women over 60, but it's also one of the most treatable conditions when caught early. The heart problems that cause these 5 symptoms, whether it's heart failure, coronary artery disease, valve problems, or rhythm disorders, are all significantly more manageable when identified in early stages. Robert, whose story opened our discussion, learned he had developed heart failure related to long-standing high blood pressure that hadn't been adequately controlled. But because his symptoms were recognized relatively early, his cardiologist was able to start medications that dramatically improved his heart function. Within 3 months, he was back to playing tennis and walking his dog without symptoms. He didn't need surgery or dramatic interventions. He needed recognition that his symptoms mattered, and treatment started promptly. The challenge is that our healthcare system often relies on patients to report symptoms, but many older adults don't want to complain or don't want to bother their doctors with what they perceive as minor issues. They normalize symptoms that should never be considered normal. So here's what you need to do. If you're over 60 and experiencing any of these 5 warning signs, especially more than one, schedule an appointment with your doctor soon. Not someday, not when it gets worse, but soon. Be specific about what you're experiencing, when it started, and how it's affecting your daily life. If symptoms are severe, sudden, or rapidly worsening, Don't wait for an appointment. Go to an emergency room. Your heart is quite literally your life pump, and when it sends distress signals, listening could save your life. The signs are there for a reason, and recognizing them is the first step toward the treatment and care that can keep your heart healthy for years to come.